Welcome back to Police Academy Prep. This is Deputy Z. Today we will be going through the High Liability book, Chapter 2, First Aid. Now, this will be the short edition. This is created for that quick test review. Maybe it's the day of the exam. You're driving into the academy from your home. Maybe you only have 20-30 minutes, but you want that full chapter recap. Maybe not as in depth, but just to give you a quick refresher before the exam. So that will be what we will be covering here in the short edition. Now, if you have not listened to the long, in-depth edition that's maybe an hour and a half plus, I would highly recommend that you do go back and listen to that if you have time. It is very in-depth. I give scenarios, question answers on the test, and I give more conversation than this quick one. This quick one is more going to be the bold topics, the quick, easy steps. Speaking of steps for this chapter, there are a lot of steps for different terms in here, whether it be for how to give first aid or steps for different types of carries. In this short edition, I will not be providing the steps. My reasoning for that is because there are a lot of steps and they're not easy to remember, especially remembering them in order. So my recommendation for the test would be to study everything else, get a really good grasp on the material, and if you find time before the chapter test, to then go back and refresh yourself on the steps. Now, I would say on the test, there will be some question on the steps. It'll be like, okay, you did this, what is the next step afterwards? Asking maybe what is step 3 or step 4 in that type of scenario. Just know there will be a few of those, and I would just rely on common sense and logic to answer those. There won't be many. So like I said, I recommend grasping the material first, and then if you have time, going back and trying to memorize the steps. So without further ado, let's go ahead and jump in here. So first thing we're going to talk about here is the Emergency Medical Services, which stands for EMS. So the EMS system is a network of trained professionals linked to provide advanced out-of-hospital care for victims of sudden traumatic injury or illness. So just make sure you don't confuse this with EMTs, which are the emergency medical technicians. This is the EMS system, and just remember, trained professionals, advanced out-of-hospital care. Then we move on to EMTs, emergency medical technicians. They use usually paramedics, and they have advanced specialized training to provide more comprehensive care than we do. So again, as law enforcement, we provide basic first aid until EMS arrives, EMTs. So test question here as well. When you arrive on the scene, what is your initial duty? Your initial duty is to determine if the scene is safe for you and other responders to enter. Always maintain awareness and scene safety. So, of course, PPE, make sure you gain access to the patient, assess your life-threatening injuries, and make sure to alert EMS providers of all relevant information. Provide the basic care and remain with the patient. Do not abandon the patient until providers relieve you. Of course, it's smart to always stay calm during an emergency. And again, criminal justice officers provide basic first aid, but we do play a vital role in delivering emergency first aid to patients who experience sudden illness or injury within the first few minutes after it happens. So generally, we will always get there first. We will make the scene safe, and then EMS and EMTs will arrive. Then we have our legal and ethical responsibilities. So this is most likely going to be a test question here. Placing the public's well-being first during an emergency will help you reduce your likelihood of acting unethically. So I do recall this being a test question. So it asked, how do you reduce your likelihood of acting unethical during a first aid situation? And that will be by placing the public's well-being first. Which leads us into the duty to act. The duty to act is a duty to take some action to prevent harm to another, and the failure of which one may be liable. So basically, we have to do something. We can't just watch. We can't just sit on the sidelines. We have to do something. You may not know what to do, but you just have to do something. Just remember, when it comes to criminal justice officers, us in law enforcement, a duty to act refers to the contractual or legal obligation to provide care. So basically, based on the contract of being a law enforcement officer, we have a legal obligation to provide care. So just know that for the test as well. And as a law enforcement officer, we have a duty to act 24/7 within your jurisdictional boundary. If you are outside of that boundary, that's where the Good Samaritan Act will protect you for acting outside of your jurisdictional boundary. But remember that they might ask you, do you have a duty to act only on the weekends, or only when you're on duty, or only when you're off duty? If that question comes up, it is 24/7 within your jurisdictional boundaries. Okay, let's see. Obviously, you also have a duty to act in regards to criminals. So whether they're in your custody and detained, or whether they've been shot by law enforcement, or any type of situation like that, you still have that contractual duty to act when it comes to prisoners, people in custody, etc. Then we get to the standard of care, which is also known as the scope of care. And this is the degree of care that a reasonable person should exercise. You're basically avoiding negligence. So it's the conduct demanded of a person in a given situation. So, for example, you can make mistakes, but you can't make egregious mistakes that a reasonable person wouldn't. So, for example, providing CPR on someone's neck, that would fall under failing to provide a standard of care, because a reasonable person knows not to, especially the training we're given, not to provide CPR on someone's neck, right? And also knowing what your scope of care is. So, for example, providing CPR is the scope of care. We are trained in that. But, for example, providing open heart surgery is not. So it's also knowing what you can and can't do, right? So CPR, to do chest seals, you have gauze, Israeli bandages, but you're not digging inside people's body to dig out bullets. You're not, maybe stabbing a pen through somebody's neck to try to help them breathe. Certain things that you aren't equipped or trained for falls under your standard of care or scope of care. Then we have the Good Samaritan Act, which I brought this up earlier. It basically protects a first aid provider from liability for emergency care or treatment performed in good faith. Like I said, outside of your jurisdiction. Then we have abandonment. This is giving up a right or interest with the intention of never again claiming it. So they might come up with a scenario on the test, and basically they might ask, what is abandonment here? And abandonment wouldn't be going back to your car to grab some more gauze, right? That's not abandonment. Abandonment means you're never coming back. So that would be, you provide some CPR, and then you just go in your car and you handle some paperwork, or you go to the next call. That would be abandonment. Then we have negligence, which is the failure to exercise the standard of care that a reasonable, prudent person would have exercised in a similar situation. And any conduct that falls below the legal standard established to protect others against reasonable risk of harm, except for conduct that is intentionally, wantonly, or willfully disregarded of others' rights. So then we have the 4 conditions, and all of these have to be present for negligence. You have the duty to act, which we talked about, legal duty to a patient, the breach of standard of care, which means you have the duty to act and you failed to act, causation, meaning your actions resulted in the patient's injury. So providing CPR on their neck and you break their larynx, and then damages. The patient was harmed as a result of your actions, aka breaking their neck. So you need all 4 of those for negligence. So duty to act, breach of standard of care, causation, and damages. Then we move into consent. We have express consent, implied consent, and informed consent. So express consent is permission that is given, clearly and unmistakably stated or written. So someone saying, yes, I consent, or them nodding, or them writing, I give consent. Then you have implied consent. So that would be like if someone rolls up their sleeve and they're like, they just roll their sleeve, meaning, hey, take a blood sample or blood pressure. Or maybe they are unable to give consent but would like help. So people that are unconscious, that would be implied consent. If they're unconscious, they probably want help. They just can't give it to you in that moment. Then we have informed consent, which is, think of informed consent in regards to going to a doctor's office. You have 100 papers you got to fill out for everything with facts, benefits, risks, alternatives, etc. Remember competency when refusing medical care. So if someone's refusing medical care, they have to be competent. They can't be fading in and out of consciousness. They can't be on drugs or alcohol. They can't be juveniles. You would have to give that from their parents. So they might come up with some scenarios and ask, hey, is this person competent? You have to determine, no, they're not, right? So if someone's in a super traumatic incident and they seem emotionally or intellectually or physically impaired, then they're not able to give consent and refuse treatment. Okay, just remember that 18 years of age under 18 years of age or minors, and you have to get legal consent from guardians before providing care, unless, of course, they need the emergency care, right? Then we're going to talk about DNRs. That's definitely on the test. Do not resuscitate, or also known as an advance directive. Just know that we do not honor these. So if someone comes up and they say, no, my husband has a DNR, don't give him CPR, you ignore that. Now, EMTs, paramedics, and licensed medical professionals, they can honor the DNR and they could do that. But again, that doesn't apply to us. That's up to them. So you do everything you can until that care is being transferred to someone else. Now, medical alert. So you have a patient that, whether they wear a bracelet, necklace, ID cards, etc. Basically, those are medical alerts, and they basically tell you their name, the contact people, any type of medical conditions they have. Then we have HIPAA. Know what it stands for. Everyone knows what it is, but know what it stands for. Health Insurance Portability and Accountability Act, and protects the rights of patients and the release of their information. Keep in mind about seeing evidence here. Let's see what other test questions we have. Patients with special considerations. So, your blind people, your hard of hearing people, developmental disabilities, dementia, patients who have juveniles. Let's see, patients with medical equipment, people that speak different languages. Let's skip all that. Let's move to the human body. Let's start with the respiratory system. The respiratory system delivers oxygen to and removes carbon dioxide from the blood. Remember that the body can only go without oxygen for a few minutes. So again, respiratory is your diaphragm, your trachea, your nasal cavity, your ribs, your lungs. Then we move on to the circulatory system, also known as the cardiovascular system, and this pumps blood through the body. It delivers oxygen and nutrients to and removes waste from the body tissues. And remember that the parts of the circulatory system are the heart, veins, capillaries, arteries, and blood. Make sure you know your arteries. Those will be on the test, and when to use which ones. So the carotid artery, that is going to be in your neck. Make sure you use that one on patients that are generally unconscious. Then you have your brachial artery. That is the upper inside of your arm. You use that on infants. Then your femoral artery. This is your upper thigh and leg area and the groin area. You generally would not use this one. And then your radial artery. That is going to be in the inside of your wrist. That one you use when on an adult patient when they are conscious and breathing. Skeletal system. So the skeletal system is the supporting framework for the body, giving it shape and protecting vital organs. It attains mobility from the attached muscles and manufactures red blood cells. Make sure you know that that's the skull, the spinal column, shoulder girdle, rib cage, pelvis, lower extremities, and upper extremities. Then we move to the muscular system. So just for reference, the muscular system definition and the skeletal system definition are very similar. They both give the body shape and they both protect vital organs. The real difference here is the muscular system allows for body movement, where the skeletal system is the supporting framework. So those are the two differences. Skeletal system is supporting framework. If you see that, you know it's skeletal. And if you see body movement, that is muscular. Just know the three types of muscles here. We have involuntary or smooth muscles, and they carry out the automatic body functions. Then you have the muscles used for deliberate acts, such as chewing, bending, lifting, and running. These are voluntary muscles. So know the muscles and know what they are. So voluntary muscles, those are like things that you're obviously doing on your own. Know your smooth muscles, which are your involuntary muscles, things on the inside of your body, such as blood vessels and organs and intestinal walls and things like that. And then you have your cardiac muscles, and those are only found in the heart. The nervous system, it controls voluntary and involuntary body activity, and it also supports higher mental functions such as thought and emotion. So again, you might think, oh, what controls voluntary and involuntary body activity? You might be thinking muscles and you're thinking muscular system. Most likely you need to look for where it says higher mental function, and that is the nervous system. You have two main parts of the nervous system. The central nervous system which is the mainframe computer. So if you see mainframe computer, that is the central, and that is the brain and spinal cord only. Then you have your peripheral nervous system, which is everything else. So if you're thinking two-way communication from the brain to the body, from the spinal cord to the body, carrying information back and forth, that is peripheral. Then we have the skin. Do know that the skin is the largest organ of the body. That will be on the test, and know that it protects everything inside the body. So a question might come up and say, what organ provides a barrier against bacteria and other harmful substances? That is the skin. So it's not always as easy as it sounds. Just make sure you remember that the skin is an organ and you'll be fine. Now we're going to move into infections. So just know that when you're encountering people, PPE, be careful of blood, body fluids, things like that. So bloodborne pathogens, these are microorganisms in human blood that can cause disease, and obviously they're transmitted via blood, generally obviously open wounds and things like that. So be careful for sharps, needle sticks, etc. Then you have airborne pathogens, which are microorganisms discharged from an infected person by coughing, sneezing, and laughing in close contact through the air. Pretty simple, easy to remember. Know what body fluids are, so they might ask you out of these options, and they'll give you each option will have 3 in them, what are considered bodily fluids. So just remember you have mucus, saliva, vomit, semen, vaginal secretion, and blood. Remember anything from inside body fluid. Know what the CDC is, Center for Disease Control and Prevention. Know what universal precautions are. Universal precautions are a set of procedures designed to prevent transmission of bloodborne pathogens to first aid or healthcare providers. So remember that universal precautions is bloodborne pathogens. So, okay. And then know what BSI is, body substance isolation. So that goes a little further, and it includes yourself from includes everything, like basically from isolating yourself from all substances. So it's not just blood or bodily fluids, but basically everything. So again, BSI goes further, and it includes isolating yourself entirely from anything related to the body, where universal precautions is just bodily fluids. Okay, let's see here. Hand hygiene, PPE, know your different types, your gloves, your masks, how to take your gloves off. I remember that being a test question, the steps to taking them off. Like I said, just use common sense when trying to answer those. Facial protection, disposal. Let's talk about bloodborne diseases. So hepatitis B. Remember, hepatitis B is blood. B stands for blood. So if they ask any, needles through blood, how do you get this one? That is hepatitis B. With hepatitis C, stands for common. So they're usually going to ask this one. It does have to do with blood as well. But with this one, they're generally going to ask, hey, which one is the most common? Hepatitis C. If they ask about hepatitis A, just remember A for ass. Not child friendly here, but that's what we're going with. A for ass. So just remember fecal matter when it comes to hepatitis A. So usually they'll say which of the hepatitis has to do with fecal transmission through fecal matter. That is hepatitis A. Know what HIV stands for, human immunodeficiency virus. And know that having HIV can lead to having AIDS, which is acquired immunodeficiency syndrome. Obviously, sexual, needles, HIV through pregnancy, etc. Airborne diseases, obviously through the air. So we have COVID-19. Make sure you know that SARS-CoV-2 is the virus that causes COVID-19. That was a test question there. And they'll try to flip that different ways. So just remember it's SARS-CoV-2. They might try to flip it and do some weird names, etc. Know that tuberculosis is an airborne disease, and it's in the respiratory system, and do know that you need close confined spaces over extended periods of time. So they may give a scenario and say, hey, can you get tuberculosis from driving with somebody in the car once? And obviously not. Know what MRSA stands for. It is methicillin-resistant Staphylococcus aureus. Just know that it's a type of bacteria that is highly contagious and resistant to antibodies, and generally know that it's open wounds, wound drainage, nasal secretions, skin contact. Hepatitis A, like I said, hepatitis A stands for ass, and that is fecal matter, and fecal can go through food and water. Scene size up, know that it has 4 components: scene safety, mechanism of injury or nature of illness, the number of victims, and the need for more rescuers and special equipment. So basically, know that scene size up begins as soon as you receive notice from dispatch. Scene size up is basically all those things at once. It's basically situational awareness. Mechanism of injury is try to determine basically what caused it and what happened. What's the main complaint? Obviously, the number of locations and the number of patients, and if you need more. So if there's 10 patients, you're going to need a lot more than one ambulance. Make sure you relay that over the radio. Then we move into patient assessment. So you have LOC, level of consciousness. Know what that is. You basically determines how awake or alert someone is. So let's go through those real quickly. You have alert, the patient is fully awake. Then you have verbal, maybe their eyes are closed, but they respond when you pinch them or move them. Then you have your pain level. This is you're basically doing the chest rub or you're pinching them, and they are responding to pain type movements. Then you have unresponsive, so they're just obviously not responding to anything. All right. Just know that when you're determining LOC for an infant or a child, visually is your most valuable tool because they generally might not be able to talk or relay information. Know what MARCH stands for. That is massive hemorrhage, airway, respiration, circulation, and head injury. Those you follow in order. So blood first, then breathing, then respiration, circulations, etc. Let's move past here. Okay, then after you do MARCH, you do the secondary assessment. So you do immediate life-threatening injuries, and then you do your secondary assessment. Your secondary assessment is DOTS and PMS. So DOTS is deformities, open injuries, tenderness, and swelling. All these are on the test, unfortunately. Kind of know what each of them are, but more know what the acronym stands for. Then you have PMS. That stands for pulse, motor, and sensory. Okay. Make sure you know how to do like the finger drag and things to figure out where there might be more injuries on someone's body. Vital signs. Make sure you continue to do an ongoing assessment. So if the patient is stable and they are responsive, you need to reassess them every 15 minutes to make sure that they are still okay. If your patient is unstable, acting erratic, not breathing well, you need to continue to assess them every 5 minutes. So no, 15 minutes if stable, 5 minutes if unstable. Those are test questions. Okay. Continue to update EMS. Now, moving patients. So know your proper lifting techniques. Unfortunately, there are a lot of steps when it comes to these ones. I would try to remember the types of positions and whatnot, and rather than the order in which they do. So know what the recovering position is. This is when you use on really anybody, but more specifically an unresponsive person. Know that the recovery position helps maintain an open airway, whether they are vomiting or struggling to breathe. Positional asphyxia, test question as well. This occurs when someone's body is in a position that interferes or prevents them from breathing adequately. Walking assist, obviously one arm over your shoulder and you're walking with them. Know your emergency drags, your shoulder drags, your blanket drags, arm drags, ankle drags. Then you have your lifts, your 2-officer extremity lift, your SEAL Team 3 carry, your leg roll, and your other type of movements here. Then we move into mass casualty incidents and triage. Okay, so know what MCI is. That is a mass casualty incident, usually severe type incidents, multiple either casualties or people not feeling well. Triage. Triage is the process of sorting and categorizing patients and is used to determine the order in which patients receive medical attention. Test question will come in. How do you determine the order in which patients receive attention? That is triage. Okay, know what START is. START is the triage process, and it stands for simple triage and rapid treatment. Know your colors. So you have red means immediate attention, yellow is delayed attention, green is minor and delayed attention, and black is deceased or non-salvageable. Unfortunately, you're going to need to know your respiratory rates, whether 30 or fewer breaths per minute you assess for perfusion. If respiratory rate is more than 30 per minute, tag red. There's a lot of steps here, unfortunately. Just breeze through them. And if you have time, try to memorize them later on. Okay, then you have SALT, which is Sort, Assess, Life-Saving Interventions, Treatment / Transport. The SALT method, it is a part of triage. It combines many approaches from other triage processes. So make sure you know the difference between START and SALT. Make sure you know that SALT adds another category, which is gray, meaning the patient is probably going to die, but they're not yet dead. So basically, don't worry about them right now, unfortunately. Direct threat care. So direct threat care, also known as your hot zone or your care under fire. Know those interchangeably because they might say, hey, direct threat care is that hot zone, warm zone, or cold zone. So know those interchangeably. So direct threat care or care under fire is your hot zone. That is your active threats, immediate danger. Know your indirect threat care. Indirect threat care is also your warm zone or your tactical field care. And know your evacuation care, which is your cold zone. And know that law enforcement is the only one allowed in direct threat or the hot zone. So EMS, EMTs, and the ambulance is not going to be there. You might get EMTs in your warm zone, but usually they are being guided by law enforcement. And then your cold zone is generally where EMS and the patients are. Know how to move patients while under threat. Make sure you know your vehicle dump, which is basically loading people into your personal car to get them out of the area as quick as possible. Okay, how to load them. Not really a big deal. I wouldn't focus too much on that. Know your officer vest drag. Then we move into shock. Shock is the failure of the heart and blood vessels to maintain enough oxygen-rich blood flowing to the vital organs of the body. Know your symptoms. Unfortunately, the symptoms of shock are the symptoms of basically everything else, so kind of hard to remember if I'm being honest there. But know how to treat for shock. So open airway, bleeding. Remember to raise their, keep them warm. Remember to raise their legs and keep their head stable. Then you have your types of injuries. Your closed soft tissue injury, pretty self-explanatory. It's closed and it's soft tissue. So you're bruising and swelling. These, unfortunately, are pretty similar, but know that bruising has your obvious discoloration, black and blue, and the injury is flat and tender to the touch. But know where swelling, you have a firm, painful lump, and generally you have more bleeding under the skin. Okay, then we have your open soft tissue injuries. You have your amputation, which is removal of loss or limb. And remember, you have your partial and non-partial. Your evisceration, where the organs are coming out of your body. Your puncture wound. Your laceration, cut to the skin. And abrasion, which is more like rubbing and scraping. Know all of these. Almost every single one will be on the test. Your types of bleeding: arterial bleeding, venous bleeding, capillary bleeding. So remember, arterial is bright red blood splurting through from an artery. You have your venous bleeding, obviously, is from a vein. That's going to be dark, and it's going to be flowing steadily. And then your capillary is dark red blood again, but oozing slowly. Know your tools to stop bleeding. You have your tourniquet. Obviously, we know what that is. Your dressings, your hemostatic gauze or dressing, and your bandages. So the difference between dressing and bandages, I know this was hard for our class to grasp, but just remember that your bandages just hold the dressing in place. So think of like your dressing being your pad, and then your bandage being something to wrap around the pad to make sure it doesn't fall off. Okay, let's see. Extremity bleeding, different types of dressings. A lot of steps here for applying dressings, steps for applying tourniquets. Make sure you know that when it comes to junctional bleeding, so like we're talking about armpit, waist, neck, things like that, you can't use a tourniquet. You got to use, gauze pads, Israeli bandages, etc. Puncture wounds, know your impaled objects, blunt or sharp objects, how to treat those. Know how to treat human and animal bites, how to treat your gunshot wounds. Then we move into spinal head and neck injuries. Let's see. No, all these types of injuries here. Jaw thrust maneuver, that'll be on the test. So remember the steps for doing that one. I would say there's only 4 steps there. I would memorize the jaw thrust. So be at the patient's head, one hand on each side of the patient's head with your thumbs resting on the cheekbones. Grasp the angles of the patient's lower jaw and press down as you lift the jaw. Move the jaw forward with both hands, pulls the tongue away from the back of the throat, and maintain your spinal motion restriction. Know what a TBI? A TBI is what? A traumatic brain injury, and is an injury that occurs when sudden trauma causes damage to the brain. Know the symptoms. Unfortunately, a lot of the same symptoms with a lot of different things. Know what infant TBI is, and know what usually causes it. That is violent shaking or blunt impact. And remember, infant TBI is for children younger than 6, so 5 and under. Know what SBS is. That is shaken baby syndrome, and that's usually a sign of abuse. Okay, eye trauma, neck injuries, different steps there. Chest injuries. Okay, so we have a closed chest injury. Obviously, the chest is closed. You have internal bleeding. Unfortunately, with this one, not too much you can do. Remember the recovery position. A flail chest injury occurs when 2 or more adjacent ribs are fractured. So just flail chest, remember your ribs being fractured. You're just kind of supporting them as well. Then you have your open chest injury, which is a penetration through the wall. Air and blood enter the surrounding area of the lungs and create a change in pressure. Then you have your sucking chest injury, and that is a larger hole in the chest wall. And as the patient breathes, the air fills in the space of the lungs. Very dangerous there. That's why you have your chest seals. Know your improvised chest seals. Know that you can use, chip bags and things like that. Abdominal evisceration, that is where the organs are coming out. Know that you need to use moist dressings that are clean. Don't use dry. So remember, when it's dry, when it's wet, use wet, and when it's dry, use dry. So just remember, if your organs are coming out and they're wet, then you use wet dressings. Okay, different fractures here. You have your open fracture, a fracture where the skin at the injury site is open. Obviously, it's open. Closed fracture is when when the bones are broken but the skin remains intact. Dislocation occurs when trauma forces the end of a bone from its normal position and it comes out of its socket. No, a strain is an injury to a muscle or a tendon that becomes overstretched, sometimes also called a pulled muscle. Let's see here. Amputation is obviously the loss or removal of a limb. And burns. Your superficial burns is first degree. Again, superficial is first degree. That's damage to the first or outermost layer of skin, which becomes red and feels painful. So remember the example of sunburn, because they could ask the example. They could ask what it looks like, aka like red and painful, or what's the degree. So then you have your second degree, which is partial thickness. This is the first 2 layers. You have swelling and red, same thing, but you have white or splotchy skin. So if they ask which one is white or splotchy skin, that is second degree burn. Then you have your full thickness burn. That is your third degree burns. It's all layers of the skin, the muscles, the nerves, waxy, white, and charred. With these 3, you might get pictures. So like I said, just know the superficial, think of like a sunburn. Your partial thickness, think that white, you might see white and splotchy. And then your full thickness, you're going to see that waxy, charred, like barbecue type style. Burn types, thermal, that is exposure to heat. Inhalation, obviously inhaling things like chemicals. Then you have chemical burns, liquids or dry powders, which is on the skin. So if they bring up any type of respiratory system burn, that is inhalation. So don't confuse chemical with inhalation being caused by chemicals. Then you have electrical burns, obviously electrical currents such as lightning. Make sure you know safety, different treatments for burns, inhalation burn treatment, different types of chemical and electrical burn treatment. A lot of steps here. Like I said, just keep focusing on the main material and worry about steps a little later. Overdose. So patients who misuse substances can sometimes experience complications such as overdose, which is when you take too much or more than the recommended amount. Just remember that not all overdoses are a result of substance misuse. Remember, it could be miscalculation, confusion, or accidentally using more. So it's not always necessarily that they're like a drug addict or it's not abuse or misuse. Know the symptoms. Know that naloxone, also known as Narcan, it does not hurt if you administer it, even if they don't need it. Know that you do it up their nose, and it reduces or relieves pain from opioids. Know what fentanyl is. Know that it mimics morphine, but it's 100 times more potent and 50 times more potent than heroin. Make sure you know your exposure levels. So your low risk, your moderate risk, and your high risk, and what's the description, the examples, and what you should do. So if they say, evacuate immediately, hazmat team, get out of there, obviously high risk. That one's pretty easy. If they're saying to just put on gloves, long sleeves if possible, if you have a mask, low risk, right? Now if they're saying, you need long sleeves, you need to cover up, double gloves, mask, and you have to, then that's moderate risk. But if you're not going in there, period, and you're getting the hell out, that's high risk. Substance withdrawal. Just know that withdrawal is a physical, mental, and emotional response. So again, withdrawal is a response to either suddenly or slowly quitting the use of substances. Know what diabetes. Diabetes is a chronic illness that influences how the body turns food into energy. Know what insulin. Insulin is a hormone that converts sugar and starches and other food into energy. Know your different types. Your type 1 diabetes, the body does not produce or very little insulin. Type 2, the body produces insulin but not properly. And then your gestational, which is diabetes that temporarily develops during your pregnancy stage. Seizures, burst of uncontrolled electrical activity between cells in the brain. That could be a blank stare or crazy shaking and twitching. All right. Asthma. Asthma is a respiratory condition in which the airway passage narrows due to swelling in mucus, which causes breathing difficulties. Know your signs and symptoms. Stroke. This damages part of the brain. So remember, stroke is the brain. Heart attack is the heart. Heart attack is when a clogged blood vessel blocks the blood flow to the heart and does not give the oxygen it needs. Know your signs and symptoms with those. I would recommend those. Those are pretty important. Those are definitely on the test. Know your heat and cold. Know your signs and symptoms for hypothermia. That was on the test. So know that hyperthermia occurs when the body cannot recover from fluid loss, and it has 3 stages. So hyper is heat. Okay. So know that heat cramps, you get headaches, and warm, sweaty skin. Definitely know the types of skin. That was on the test. So they might say if you have warm, sweaty skin, is that heat cramps, heat exhaustion, or heat stroke? So heat cramps, warm, sweaty skin. Heat exhaustion is your moist but cool skin, and your heat stroke is just hot and dry. So heat stroke is hot and dry. Heat exhaustion is moist and cool. Heat cramps is warm and sweaty. Okay, heat stroke is like threatening. Heat cramps and heat exhaustion, you just treat accordingly. Then you have cold, hypo. So just remember hypo, cold, where hyper, there's an E in there for heat, and then hypo, O for cold. So again, hypo is for cold. That is an excessive cooling of the body's core temperature, and frostbite is a localized injury from overexposure to the cold. Let's see here. Abdominal pain, poisoning. Know your symptoms of those. Anaphylactic shock. This is a life-threatening emergency. It's also known as anaphylaxis. Results from insect bites, stings, pollen, medications, food, chemicals, or any substance that triggers a severe allergic reaction. So they might say any substance that triggers a severe allergic reaction is a what? Is an anaphylactic shock or anaphylaxis. Then we get into labor, which is our last section here. There's going to be some questions on labor. Not a whole lot, but do know it. A lot of steps here I would not recommend. There's way too many steps. We're talking about like 30, 40 steps here between them all. I would not recommend doing these. These are probably not as important. Even if they are on the test, just use common sense. Know what the umbilical cord is, a narrow cord of tissue that connects the embryo or the baby to the placenta. The placenta is an organ that forms their pregnancy and attaches to the uterus, and it nourishes the fetus. And then know your types of complications. So around the neck, the cord prolapse, the breech delivery. I'm pretty sure the only one we can help is the cord around the neck. I'm pretty sure the rest, if I'm looking here, whether excessive bleeding, breech delivery. Know that breech delivery is when the feet or the butt comes first, not the head. The cord prolapse is when the cord comes out first, and obviously excessive bleeding. So those last three, we have to just keep elevated, recovery position, whatever, needed chest position to relieve pressure are basically the steps for those, and we wait till EMS arrives. Obviously, continue to update EMS. Now, that concludes our short edition. Hopefully, I maintained a reasonable amount of time. It looks like I'm at about 40 minutes, but the original long extended version was, I think, over an hour and 40, so I cut this down by probably about an hour. Like I said, if you made it all the way through, congratulations here. I would recommend listening to the long version and kind of saving this short version for a quick, fast recap. Good luck on the test. Stay confident in it. When it comes to the steps, if you didn't memorize them all, that's okay. Just make sure to use as much common sense and logic as possible. When it comes to a lot of symptoms, I would say with most of these, symptoms are really the same across the board. If you get a symptoms one, try to just pick up the symptoms that are unique to that specific issue and go from there. Good luck on the test. I will see you on the next chapter.